Hi, my name is Connie Laplanis and you're watching the video Brown Syndrome Classification. In this video, we'll be discussing the types of Brown syndrome and the associated signs you expect for each of these types. So in essence, there's three types of Brown syndrome: mild, moderate and severe. In order to classify a patient as having one of these types of Brown syndromes, we're interested in three positions of gaze. So if we have a look here at the child to the right, we see 9 positions of gaze. In order to classify the patient, we need primary position, as we see here, lateral gaze. In this specific instance, we're looking at lavoversion, but it could be dextroversion, depending on whether you've got a right or left Brown syndrome. And also elevation in lateral gaze, in this instance, lavo elevation. And what we're looking at is the deviation in these three positions. So for a mild Brown syndrome, we're specifically looking at lavo elevation, and in this particular instance, we'll have limitation of elevation in adduction, and this will be the only sign of the Brown syndrome. For a moderate Brown syndrome, we now not only have limited elevation in adduction in lavo elevation, but we also see a hypo deviation here in lateral gaze. So in this position, what we would see is a downshoot or a down drift as we take the patient across into lavoversion. For a severe Brown syndrome, we will not only see now the limitation of elevation in adduction and the downshoot or downdrift in adduction, but we'll also see something in primary position. We'll actually see a hypo deviation in this particular position. So as you can see, as you move from the mild, moderate to severe types of Brown syndrome, more positions of gaze are being affected. Let's have a look at patients with each of these types of Brown syndrome. Commencing with mild, we see here that the patient is aligned in primary position. There's no hypotropia. As we move into right gaze, there's no downdrift of the left eye in this position. But as we move into dextro elevation, we see limited elevation of the left eye in adduction. So here we have a left Brown syndrome, that's mild, or a left mild Brown syndrome. Moving on to moderate, again in primary position the patient is straight. If we move over to lavoversion, we start to see the downdrift of the right eye here, and as we move into lavo elevation, there is a significant limitation of elevation in adduction. So now we have 2 positions affected here, both lavoversion and lavo elevation. And here we have a right moderate Brown syndrome. And lastly, here we have a patient with a severe Brown syndrome. In primary position, we can see that we have a right hypo deviation. As we move the patient over into left gaze, there is a significant downshoot of the right eye. And as we move the patient into lavo elevation, and this in this particular instance is achieved by the patient moving their head rather than their eyes, we can see that we have a significant limitation of elevation in adduction. So now we have 3 positions affected: lavo elevation, lavoversion and primary position, which classifies this patient as having a right severe Brown syndrome. In summary, there are 3 types of Brown syndrome, and in order to classify the patient as having either a mild, moderate or severe, you need to consider the deviation in 3 specific positions: primary position, lateral gaze, or when the eye is in adduction, and when the eye is elevating in adduction. Now for all 3, mild, moderate and severe, they will all have the sign of limited elevation in adduction. When you move to moderate, however, you'll also have a downshoot or a downdrift of the adducting eye. And then finally, the severe will have both the downdrift or downshoot in adduction as well as the limitation in elevation. And on top of that, it will have a hypodeviation in primary position. Okay, that brings us to the conclusion of this video. Thank you for watching.